Good afternoon, and welcome to Strategies and Tools for Easing Nurses' Cognitive Burden, a health system CIO production sponsored by Get Well. Just a little housekeeping before we get started. My name is Anthony Guerra. I'm the founder and editor in chief of Health System CIO, and I'll be your moderator today. We're looking forward to your participation. You can send in your questions or comments at any time in the Q&A box, and we'll take them later in the program. Just so you see how we're going to spend our time, we're going to go about 35 to 40 minutes with our main panel discussion featuring Kat Collard, CNIO with Christiana Care, Simi King, Chief Nursing Informatics and Education Officer with Children's National Hospital, and Catherine Verkstis, VP Clinical Advisory Services with Get Well. And then we will have our Q&A. So let's jump right in. Kat, let's start with you if you want to give us an overview of your organization and your role.
Hi, I work for Christiana Care Healthcare System in Delaware. We have three hospitals, one located in Maryland, two in Delaware, Wilmington, and Newark. Over 100 ambulatory sites. We do quite a bit of research and education, medical education here as well. So my role as CNIO, overseeing all the technology and integration for nursing and ancillary departments.
All right, very good, Kat. Thank you. Simi?
Hi, good afternoon, everybody. I'm Simi King. I'm the Chief Nursing Informatics and Education Officer here at Children's National Hospital in Washington, D.C. We are the region's pediatric healthcare system, the freestanding academic pediatric center, just over 150 years old. And, we are 323 licensed inpatient beds, but with a huge footprint that crosses Maryland, Virginia, DC, and all the way actually all up to Delaware with our ambulatory services and also school services, which is a unique model we have here at Children's. My role, I as the CNIO, oversee nursing informatics and work collaboratively with our Chief Medical Informatics Officer and CIO through our IS structure. And then uniquely, I also have oversight over nursing education and professional development, nurse wellness, and our interprofessional stimulation program.
All right, very good, Simi. Thank you. Catherine?
Hi, everyone. My name is Catherine Verkstis, and I am the Vice President of Clinical Services with Get Well. And Get Well is a digital technology that's been around for 25 years. We're just about to have our 25th anniversary. And we provide personalized digital kind of engagement experiences for patients at every step of their healthcare journey. So before the hospital stay, whether it's they're preparing for a procedure or have a chronic condition, during a hospital stay, in preparation for discharge, following discharge. So we support patients at truly every single step, including closing care gaps and recognizing when there are patients who have missed care, we can reach out to them as well. And in my role, I lead all the clinical teams here at Get Well and make sure that the technology lives up to its clinical promise.
All right, excellent. Thank you, Catherine. All right, Kat, let's start with you. What are the primary cognitive burdens nurses face today, and how can technology help? I know that's a big general question, but we'll certainly drill down from there, wherever you want to start.
How many minutes do I have for the answer? Primary. It's I would say first off that our EMRs need to be organized in a way that will help the nurse's cognitive burden. But I think for us, a big part of that is the communication and alarm management. We have alarms going to phones on some units where we have a large cardiac population. That becomes a very big burden. So health systems, considering maybe trying to save money, not having a command center for that, puts that burden then on the nurse themselves. And in and of itself, if it was the only thing they had to monitor, it may not be an issue, maybe an issue, but I think that when you put all the other things layered on top or with it, it becomes very, very challenging. So I don't know that it's exactly one thing. I think, but their cognitive burden is really many, many things, and sewing things together in a way that will make sense for the nurses is really, I think, what our goal should be.
All right, very good. Kat, Simi?
Yeah, I concur with Kat that it's really a multifactorial issue. I think when you think about what is cognitive burden, you really think about the ability to actually recall or to be able to organize, or the ability to actually manage something in an effective way, right? Their ability to do that. But when we have so many different distractors and or nuanced workflows or disruptors in our work environment, it challenges the individual in task management, even, let alone critical thinking and clinical reasoning. And so when we think about how technology can support that, absolutely creating an electronic health record that is user-friendly, that's easy to navigate, that has features that allow the person to seamlessly work through their workflow within role and then across roles, so that it's an experience that is the same for all. I think that's why the clinical decision support is also really invaluable. So when you think about alarm management, can we be more proactive in that to mitigate those distractors that increase cognitive burden, and or task management done in a more meaningful way in the EHR? I also think, I was put my education lens on, and I think that with high turnover, which what's happened in the nursing workforce, the burden of being able to recall and access information for nurses who are younger in their work experience, and high turnover and the loss of intellectual capital. So we should leverage technology to make resources or reference materials very accessible, and technology should enable that, whether it's on a smartphone device and or in the EHR or other methods where they can easily access the information they need right now, instead of trying to fumble through and try to figure it out, which increases burden.
When you say you're talking about resources and things like that, do you mean how to do something within the software? So I can't figure out what I'm doing here. There's a tab, I can click on it, get a quick tutorial and figure out how to do it, or you're referring to something else?
I think it could be related to the how to use the technology, but I hope that the infrastructure of the organization supports training and how to use technology, and they have strategies for troubleshooting. But I mean, our clinical work, right? There is so much to know in our clinical work and space, especially when nurses float across units, that it might not be an area of expertise. And so if you have embedded resources, ways to get to those resources easily, so we're not just streamlining documentation, or but we're using clinical decision support for access to information that improves our capacity to provide care.
All right, very good. Catherine, your thoughts?
Yeah, I agree with everything you both have shared, Kat and Simi. And what I want to call out are the interruptions. So the data point that sticks out in my mind is that nurses are on average interrupted 9 times per hour. And I want to credit my colleague Sharon Pappas, who she and I have recently co-authored a paper on this, and she's we've been working together. We've presented it a couple of times, but kind of think about these interruptions almost like a mental pause button, only without the ability to fast forward or rewind. So you can't simply pick up where you have left off. You've got to reorient, which takes time and mental energy, and that sort of becomes a disruption in the flow of work, meaning that each element of work then takes longer if you're constantly interrupted and have to go back and reorient. And so this is the this can lead to the type of environment that can make us more vulnerable to errors or things like sentinel events. So this is the something that we have the really ability to try to address.
Can I just jump in really quickly? And
Please.
I think, yeah, Catherine's point about interruptions, and I know Kat mentioned it as well. That also translates to the experience for our patients and families, right? And this concept of what disruption causes in terms of an experience. And I know that for many of us, we look at the technology that supports virtual nursing as an opportunity to mitigate, in a lot of ways, a workforce issue or a throughput issue. But, having recently completed a virtual nursing pilot here at Children's, one of the things that stood out the most was patient and family feedback about the uninterrupted discharge experience, right? And the cognitive burden on a nurse who's managing multiple patients in trying to get back to that patient to really give them a safe discharge, right? It can be overwhelming when you're constantly being pulled in multiple directions, but virtual nursing has enabled us to have this environment that's a one-to-one relationship between that nurse and that patient on discharge that is more than likely uninterrupted. And that experience is pretty exceptional from the feedback we've seen.
I
Very good. Go ahead.
mind if I just follow on? Because I love that point, Simi, and I think there is something to be said about the ability to be present in one's work. I'm a mom. I think the moments when I am at my best as a mother is when I am present for my son. I'm not sitting there saying, let me just finish this email, let me just do this other thing, I'll be right with you. We all felt like pulled in different directions. And it's like, we know we're at our best when we can be present. And I think really what nurses, what they crave is to be fully present in their work and to be able to give patients the full attention and to be able to listen, to be able to respond without being, pulled in or ragdolled. And I think you're right. When we are feeling pulled in many directions, that emanates, and our patients can feel that and even to absorb it to some extent. Fortunately, I believe also the flip of that is true. When we feel present and joy in our work, the patients, I think, feel that as well.
Mm-hmm.
Well, we've had a similar experience with virtual nursing. So I totally agree with you. I agree with both of you. And there's several, I think that virtual nurses and that practice is very valuable to take some of the burden off the nurse at the bedside. Takes a little while for people to get used to the idea of it and how it works, because as nurses, we want to just do everything right. But in reality, I've sat with them and watched them practice, and some of the things that they do and pick up on would be really difficult to do with the amount of cognitive burden that nurses have on the unit. So I think it's really super valuable practice for sure.
So, Kat, this would be the kind of thing where the physically present nurse may have taken care of the patient for most of their stay, but then the discharge portion would be done by a virtual nurse. So the patient would be told, this is how this is going to be handled," meaning your regular nurse is not going to participate in this process.
Actually, Christiana Care doesn't work like that. The virtual nurse does a reasonable amount of any non, physical touching or in the room type of work. So they could have been your admission nurse a couple days ago. They also attend rounds when the team's round on the patient. They pop into the room, and a lot of that is very valuable because the patient. I don't know about if this happens to you. I'm sure it has. The team leaves, and the patient says to the nurse, "What did they just explain? Right? What did they just say?" And so that virtual nurse can explain a lot of things to the patient. So it's not just discharge. Obviously, they can do education on medications. They just can't give the medications. But they can do teaching all during the stay, answer questions for the patient, things like that. So just
Simi,
Yeah.
Which is not the only time, the first time that they see the virtual nurse. That's what I want to share.
Yeah,
how's
no,
it working by you, Simi?
I totally agree. I think that the virtual nurse role is, it's interesting. It is historically, Kat probably remembers the admissions nurse, the resource nurse. We've called it a lot of things, but historically they've been in person. And oftentimes that role does get pulled into staffing when there's a need. And so that resource doesn't become a dedicated resource. I think the unique feature of virtual nursing is it addresses a workforce need, but it also enables that role to be dedicated in its function for multiple workflow support, such as admission, discharge, transfer, education. And earlier I mentioned availability of resources to staff that are built into the EMR and or the smartphone. Well, the virtual nurse is one of those resources that helps the younger nurse give them peer support, help them through maybe a procedure or a clinical care need that they haven't performed before, but maybe someone else is not available. It might be just off of orientation. They still need a resource. So I think that technology enables multiple strategies through the virtual nurse concept.
Catherine, anything you want to add there?
Yeah, I mean, what we've been talking about so far with virtual nursing is sort of a division of work where you have one person managing a lot of the ADT and documentation and things that are not requiring a nurse's hands directly on the nurse. So kind of a division of the work, and that the in-person nurse is then really focusing on that hands-on patient care. What we haven't talked about is another model we see in virtual nursing where you have an expert nurse who supports the bedside care team. And, we have an increasingly widening experience complexity gap in nursing, or I should say experience complexity gap. So care is becoming more complex. It has been for a while, both in terms of like the patient's conditions, but also the way we deliver care is becoming more complex. And at the same time, we have a more novice nursing workforce. If you just look at the demographics, has tilted more novice. So it's this new challenge of how do we deliver more complex care with a more novice nursing workforce. And one of the things that can help us with that is to scale the expertise of truly expert nurses. And we also have, an aging workforce that might want to continue working for a while, but not necessarily be as physical. So that's a really neat way to think about how can we ease cognitive burden for, newer nurses that aren't as experienced, but can be supported by someone who's, kind of an expert in their back pocket, if you will.
Oh, very good. Very good. All right, next question. Simi, let's start with you. How can we ensure that the new tools intended to ease nurses' workload are developed with their input and are truly user-friendly? I guess we're going to go into some governance there, but go ahead.
Yeah, I mean, I think that any technology requires an iterative feedback loop, right? And so whether it is in a very conceptual way, looking at just designing it right now, maybe it's an innovation, maybe it's a vendor product that you're bringing in, but you really need to think about how you're going to pilot it so that pilot allows for that iterative feedback. Like I always say that in quality improvement, we're doing quality improvement. In informatics, we'll talk about optimization. And I know as an educator, we'll always talk about action and research. Actually, they're all the same thing. It's really an iterative process of continuous improvement. And when you're in the early stages of something, especially technology implementation, you really need to know that you are designing it so that the end user, the person at the point where the care is going to be delivered in healthcare, understands not just how to use it, but how it supports their workflow. And so they have to be engaged. So it's got to be user-centered design. We've got to think about design principles that take into consideration how we work, not just how technology functions, and to really think about how we can optimize that. And one of the things that I say to everybody when they're thinking about adopting technologies for their workflows, change management is essential to that process. And for many people, sometimes they are really resistant to that change. And the analogy I always give is, I know that you don't want the original version of the Apple iPhone that dropped in 2007 still, do you? I know that you appreciate that Apple continues to evolve. And so in the same way, our technology needs to evolve, so it's giving you the optimal experience of that technology to meet the need that you have. And so that change management process is essential, and it requires surveillance and monitoring and understanding when that change is necessary.
Excellent. Catherine?
Yeah, I'm a big fan of the simple, like, what's one thing check-in. So, like, what's one thing we could automate or simplify that would make your work easier? And just to give you an example of that, so GetWell provides patient education in the television or while in the hospital or in one's personal device. And you know, things like if a patient triggers a certain risk level on a fall risk, can that automatically assign a fall risk education video for patients? And then on the back end, can we auto document that the patient has watched the education, answered the question about comprehension, whether or not they understood it, and who watched it? Was it the patient or a caregiver or what have you? So those are the types of things. Can we simplify? Can we automate their workflow? I think when I think about technology more broadly, when it comes to like implementing new technology, there are a lot of lessons there as well. And I think it's involving the end users early and often and helping to understand like what are the things they might have some fears around, like what are the unknowns that could be clarified for them, and understanding what they see as like the risks. What are the big changes to their workflow that will need to happen, and where are their habits that would need to be changed? Another big part is, how does this impact their identity? You know, if I'm a nurse and I've always, this one thing has always been part of my workload and now it's going to be covered by someone else, how do I feel about that? And does that change my own like thinking in terms of my identity as a nurse, and how do I reframe that? And then also just questions around empowerment. You know, how does this change shift the way you feel empowered to do your work? Those four things come from a framework that was not written by me. It was designed by a researcher named Michaela Carasy, who's from the Harvard School of Public Health. And it's something that I've tapped into a few times, more than a few times, as we think about implementing new technology.
Very good. Kat?
So in my career working with, I'll just take a little bit of a vendor track. We have, I think it's very important that nurses be at the table when they're designing their solutions. And I think it needs to be really experienced nurses. I've worked in informatics for almost 30 years, and in this role in informatics as an analyst, as a designer, I think you really need to have somebody that's been at the bedside for at least 5 years or more, so they understand not just the idealistic what you learn in school, but what actually really happens at the bedside, so they can appropriately design systems. And I think that nurses really need to have that strong voice. You know, you see a lot of work being done for physicians, maybe because they are billable, that makes it more important. But honestly, I think that nurses need to have a really strong voice in all areas around this to make their cognitive burden load lower, and so that they can actually help in a lot of ways with the patient. So I think that's super important. And when, you know, from the organization side, just getting nurses away from the bedside to sit and, you know, go over things and answer questions like Catherine brought up or Simi brought up can be very challenging for staffing. So that's something that, as you know, an organization needs to really think about how important that is. So new tools, I think that we're in a starting to really, you know, roll out things with artificial intelligence and things like that. We need to really do that for nursing, as I know we're working on things for physicians, but we need to work on it for nurses too. Helping them in, remembering there's things to do. I don't want to make it sound like nurses have bad memory. They don't. They're just being bombarded with chaos all the time. And so it's very difficult to remember all those things that come that, oh, I got to do this for Mr. So and so, and I got to do that for Miss, like if they were able to, um, you know, put a task in to remind themselves to do things or something to that nature, or just be able to say it on a phone and it feed back to them. Um, Things like that would be really helpful. I think that we worry about having, tasks sent out to nursing, and that's a standard of care. Why do we need to do that? Why do they have to have that? And the answer is that they're dealing with the massive amount of chaos, and sometimes they want it because they know they won't forget, because of the amount of things that are flying at them. So I think we need to, now EMRs I think can be very uh, siloed. Different parts of it could be very siloed. I think it needs to be really brought together and tools put in it so that things are shown and put in front of the nurse in a kind of a, not a scheduled fashion, but maybe in a scheduled fashion so that it's easier for them to remember and not forget things. And their memory's great. I don't anybody think I don't they think that it's just the amount of burden that they have to deal with is enormous.
Can I,
Kat, go
oh,
ahead, Simi, please go
yeah,
ahead.
so two things. One, I think two important things are, one, as much as we say we need to bring nurses to the table, with the amount of non-healthcare startups out there in healthcare, especially from a technology lens, right? Our vendors need to be at our table as they're thinking up their innovation and their ideas. They need to not try to solve the problem on their own first. And I also think that often a technology, rarely do we have a technology that's trying to solve multiple workflows. Typically, a lot of the technologies we're integrating, here it's gonna ease the burden of this, or it's gonna ease the burden of that. And so what happens to a lot of healthcare and organizations is, oh, well, we need this technology and this technology and this technology and this technology, and suddenly you're in technology overload as much as you're in it information overload. And I think so. Part of that is if you work with the clinicians at the front line, if you really listen to how they work and how Kat's describing the multitude of tasks that nurses have to manage, but nurses don't just manage tasks, right? They're also thinking and problem solving and predicting and trending. And if you're purely task managing, the science of your work is getting lost, and that has an impact on our ability to provide care. So when we're thinking about how technology actually really eases nursing workload, we really have to understand what nursing workflow is so that we can mitigate workload.
Catherine?
Yeah, I wanted to pile on a little bit because Kat, I think what you were describing, I sometimes think of it as the invisible workload. It's like the mental weight of always having to think 3 steps ahead. So Mr. Smith in room 305 is waiting for discharge, and Miss Jones in room 302 needs a med check, and the family in room 308 has questions, and it's like this giant chessboard, but it's always moving. And so I think that's what you were describing, and I know it's still kind of this is the problem that we have the opportunity to address. Can technology help with some of that prioritization, and with things like just having more real-time information communication, so that you're not having to do as much of that in your head.
Wow. All right. Lots of good stuff there. Let me just follow up a little bit, Simi. I'm going to play a little devil's advocate here because with the pilot situation, you're talking about some products, sometimes vendor products are being brought in front of you, and it's fairly obvious to you that there wasn't a lot of actual nurses involved with the development. You would hear on the other side, the vendors would say, well, we can't get in. We can't get into the health system to partner on things until we have something. And we're not going to have anything good until we get in and we really understand the workflows. So it's like a chicken or the egg thing, right? You want it brought to you pretty sharp, reflecting workflows, but they might say, we can't get in there until we have something viable. So any thoughts on that?
I think that that's why having an innovation arm to your organization is so important. Looking at how you look at R&D from a technology lens, thinking about how do you support that type of innovative spirit and culture within your organization. You know, we need to create a structure that allows for us to co-develop and partner with our industry partners to lead in those spaces to advance technology that improves our clinical workflow. We shouldn't say, well, let them go build it and bring it to us, or let us try to build it when we don't have those technology prep. But we might not have the expertise from that lens. I think that whether you're co-creating or whether you're co-developing, that collaborative spirit is vital and necessary. And I think organizations need to support that kind of innovation. Children's is a Get Well partner and client, and we look to organizations like Get Well to work collaboratively on it. And I think that's what sparks the innovation. That's what sparks the ideas. That's what sparks the capacity to take something from an idea to, alpha, beta, and generally available, right? Like the only way to get there is to do it together. So you've got to have an innovation arm within your organization that allows for that, for chance taking, right? And doing that work.
And one of the things, I'm glad you brought that up, Simi. One of the things we've done within Get Well is built some infrastructure to support that. So 2 different structures I would mention. One, we've developed a nurse executive council, which Simi is part of. And so we've brought in, chief nurse executives from across health system partners, not only those that we work with, but those that we don't. So across, really around the country, to gather their input on what are the problems that need to be solved, how should we run after that, how can technology help and support. And then the other structure we've created is a pediatric leadership cohort. And that one meets quarterly, but we bring pediatric leaders together to talk about what are some of the challenges that are unique to pediatric organizations, and how can technology help as well. And selfishly, I approach each of those conversations because I want to learn from them. But I also see there's real value in the structure, in just bringing people together and creating a forum for them to share ideas with one another. And so I aim to make it, something that is both standalone value, but something that we all can learn from.
Kat, any thought on this concept of perhaps having an innovation arm being quite important, because people who have or organizations, vendors that don't have that exposure really can't bring you something that would be truly valuable?
Well, we have an innovation center here at Christiana, so of course I'm totally in agreement. We can do lots of things. We can do evaluations of workflow and different solutions, and do an exploration and kind of be a think tank of different things. So we do develop innovations here. There are nurses in our organization who have patents based on some of the things that they've created. And I'm, of course, I'm a full believer in it, and work with nurses all the time to lead them into this type of innovation so that they can really develop. We have a innovations group, which I'm one of the leads for, and we do lots of things like nurse hacks and all that. So yes, absolutely.
Catherine, I want to follow up with you on some, Kat, I'm sorry, Kat, I want to follow up with you on something you mentioned before. Uh, we're talking about reducing nurses' cognitive load. One of the biggest technologies out there people are talking about for reducing the cognitive load, of course, is AI, specifically ambient listening, to help in the background, listen to an encounter between a clinician and a patient, take the burden of worrying about gathering all that information for recording it, making sure nothing's been missed, and then organizing it. Takes that quite a bit, if not all of that burden off. I've read a number of studies being done, but as you mentioned, they're related to physicians. So they're rolling it out for physicians. They're trying to make the docs happy. There have been different results there. Anecdotally, extremely strong. Quantitatively, a little less so, but certainly anecdotally, very strong that these things are having a huge positive impact on the physicians. Where
Mhm.
are we with the nurses? Why are we not seeing this stuff? And maybe it is, but why are we not seeing this stuff being rolled out for the nurses? You would think it would be extremely valuable there as well.
Yep, it's a good question. I don't know if I have a total answer for you. However, as an example, I think it might have been Simi that mentioned it before, but nurses do things like they'll get lab values back, right? And I might be the nurse on the floor, it might be my first day with these patients. Um, I have to go and look at that lab value, but I've got to look at it in the realm of the history of the patient and the history of the prior lab values, right? So that's some of the stuff that Simi was talking about doing analysis and discovering and doing all that stuff. But if the lab value would come back and the system would also go gather the rest of the data that I would normally have to get and put it in front of theirs, would save me a huge amount of time, right? I had somebody say to me yesterday, and I'm smiling because I think she might be on the call, that that finding a piece of information in the system was really difficult, and it's not uncommon that there's pieces of information. That's what I say, things are siloed. Pieces of information in the record, you have to know where to go get them sometimes. It's not that obvious. But if you had AI and you were looking for certain things, an algorithm could pull things together, so you wouldn't have to go search for them. So there are lots of things that can be designed to make a nurse's life easier, and they should be, because right now it's like, oh, I have to go here for this and there for that and somewhere else for something else. Why not pull it together? And I think some of the vendors have tried to do that at some level, but I think with our ambient listening and AI moving forward, I think we have opportunities there that we could really grow on.
Simi, what are your thoughts around AI, ambient listening, these kind of things?
Well, I think with ambient listening, definitely we're actually, I think, in the midst of a pilot in our ambulatory setting, so with our provider group here, but totally agree that there's nuances to how it's implemented. So being in a pediatric hospital, I've been wondering what ambient listening will look like in a patient room when you have an infant crying, right? Or every time you go to change a diaper or do a feed, all the alarms go off. So it'll be interesting to test the model of ambient listening in an environment where there's more noise. I'll be interested to see what it looks like. But I think we need to do that, and we need to be more nimble and move forward more quickly with the technologies that have been proven, and continue to do rapid tests of change in spaces where it hasn't occurred. And I think that that's what will kind of help us propel us forward. I think it'll also mitigate some of the concern around these technologies. I think sometimes when the use case is so narrow, people can't see the application outside of what it's been used for. And then we start to think, oh, it can't work, it won't do this. And so I think even with AI, generative AI does not generate new knowledge. All it does is doing exactly what Kat is saying. It's taking information that has not been curated in a way that's digestible,
Mm-hmm.
or just digestible right now in the moment that you need it, to create efficiency or to make a
Yep.
decision or to be better informed. And so it's not going and getting something that's not real. It's going in the EHR, it's looking at this person's information, it's telling you, hey, let me make this easier for you so that you can provide better care right now, rather than spending 30 to 40 minutes getting all of that information, gathering it, and then making a decision. And I even see that helping virtual nursing. I was, and I'm not sure, Kat, if you guys experience this, your virtual nurses probably spent a lot of work time doing discharge prep before they
Yeah.
actually discharge the patient, right? They got to go make sure that the authorization's done, that this is done, the orders are complete, that the physician sent the e-prescribing notes, that they did this. Can you imagine if the virtual nurse got a summary of the criteria for discharge was met, not met, and what's outstanding in 5 seconds, and was able to actually move the discharge prep process forward quickly? So I think the opportunity to use generative AI is amazing. I think to get to a place where we can have algorithms that are more predictive, that can automate and remove any part of documentation that doesn't require a human to reduce the burden. All of those things we should try to invest in through the use of automation, through machine learning, through AI. We should take advantage of these technologies because the care is so complex, to Katie's point, and the clinicians are novice, and it's not just the nurses that are novice. Remember that. We talk about a novice workforce, and we only talk about the novice nature of our nurses. But most healthcare organizations are staffed with novice clinicians in every area, in many ways, especially in a high turnover environment. But most of our physicians are still learning, right?
Hmm.
So it's novice plus novice plus novice plus novice. Yeah. So yeah, we have to bear in mind that it's not just our nurses who may have that experience complexity gap.
Catherine, anything you want to add?
Yeah. So the really, this is the most exciting topic for me and for us right now at Get Well, because we have new owners and partners, and that is a company called Symphony AI Group and SAIG. And SAIG is like kind of a global leader in AI technology, and they've been doing this for many years and have two other healthcare companies now in addition to Get Well. Historically, they've been in the physician space, not surprisingly, it's where AI started. But a big part of the gap they wanted to fill in partnering with Get Well was around patient experience. And so we're just at this moment where our teams are developing our technology in new ways to infuse AI and to make sure that we're doing so in a way that supports patient care. And some of the examples of the early use cases that we'll be building are things like, can we build exactly what you were talking about, Simi? You know, can we collect that information on discharge readiness and put it in front of the clinical care team instead of waiting for them to, have to gather it on their own? Can we more proactively communicate with patients and their families instead of waiting for them to find the technology? Can we bring it to them? And can we adjust tone and timing and messaging based on what patients are and families are ready for? How do we adjust our own messaging to help them absorb the information in the best way they can? Can we provide summary? So we do patient education in the form of videos, and can we then create summaries of the most salient points around healthcare information, around medication, and then can those summaries also be tools for the clinical care team as well? So these are all here's a quick summary of all the information you would have heard across your 3 days throughout all your patient education, but like here it is in a nice distinct summary just for you, ready to go. So these are the types of things that we're building. And then the one thing I'll say is I don't want to underestimate the power of companionship. I think there's possibility here. There are things that AI can do to help like create a sense of companionship for patients, especially in the hospital. It's an isolating place to be. It can be lonely. And I know I started out by talking about the ability for care teams to be present and for nurses to feel present in their work and to be able to, focus and listen and have a conversation with a patient. But also nurses have a long list of things they have to do and they probably can't sit for an hour and listen to, the stories about a son's, research project or something like that. So can AI also help provide some of that patient engagement and companionship? So there's so many different possibilities. We're just at the very cusp of scratching the surface in terms of what I think we can do to support both patients and the clinical care teams. And I'm so excited to see where we go with it. Yeah.
All right, excellent. Let's go to our Ask a Co-Panelist segment. Catherine, I'm going to start with you. Do you have a question for one or both of your co-panelists?
I think Simi, I would love to dig in a little more deeply to your initial question, your initial thought around vendors versus strategic partners and, working with leaders to make sure that we, build things that meet your needs. And I think I'd be curious to know, as you think about GetWell and what GetWell very well as just as an example, what is some guidance that you might have for an organization that is trying to continue to create the right technology to meet your needs?
Oh gosh, I feel like that's such a big question. But I do think that I do think that the bringing people together to try to define what we're trying to solve with our healthcare organizations and our industry partners is essential. You're seeing a growing number of events where they're coming together, right? We're not just seeing nursing conferences and medicine conferences or this technology conference, but I think that collaboration is the foundation, right? That beginning part of being able to start to now look at healthcare differently. The reality is that as we think about our future, that's going to be so necessary because industry partners in healthcare are not just the pharmacist, the physician, and the healthcare institution. It's the wearable device now. That's an industry partner, and and what's happening in your home. It is our tech companies, in addition to what's been historically there, and where healthcare is going to be delivered is going to look very different in the future of the healthcare ecosystem. And so all of that collaboration is necessary. I mean, I think at some point our car is going to be able to tell us what our health is too. It's just going to be so different. And so if we don't partner early on, when we start conceptualizing, right? And we start to really think about the problem that we're trying to solve for the future. And we really think about future-proofing healthcare in a way that allows us to move from being ill to being well. I think that it's that initial piece of coming together, having the conversations, building structures that support innovation, and really clearly defining what we're trying to solve, right? So, yeah.
Excellent. All right, very good. Simi, do you have a question for one or both of your co-panelists?
Oh my gosh, I think I could think of lots of questions. But I guess for me, really, what do we think if we wanted to future-proof the future, right? With technology as a strategy, what would be two strategies that, Kat or Katie, that you would think of?
Kat, how do you want to future-proof?
I can start. Well, I think we've been talking about this forever and a day, but interoperability, where I can pick up the phone. I mean, some of the as a patient, like I take care of my 95-year-old dad too. Um, some of the organizations have some of that built in, where it's easy to reach a caregiver, um, even if it's it is a nurse or somebody watching the screen and then getting the doctor involved, whatever, if that's needed. Um, but really being able to get the right information, like you said, you packed one of those sentences into a punch. Like, how do we move from being wellness health system or health organizations to from illness and sickness, and that's really jam packed with stuff. um, but how do we get information to patients that's the right information? I mean, people are all over the web, a lot of stuff that's not right. And I was going to ask Catherine about, Get Well. Of course, I'm sorry, we don't have Get Well at the moment, but have you thought about this virtual nursing piece? And, I know that it provides a lot of things in the room, but combining solutions in a way that can also, help streamline some of the nurses' work. If you have virtual nursing able to come into the room and you have, Get Well, and you have education that's provided to the patient, things like that. So I think like taking, vendor partnerships and trying to, look at the workflows and things that you could really streamline in a product. And I realize that's jam packed with stuff too, but maybe something really to consider.
So two questions that I want to answer here. So Kat, I'll start with yours. For virtual nursing, we do that already. So we're partnering with lots of different organizations to provide virtual technology, not only for virtual nursing, but for families, specialists, interpreters, navigators to be able to dial into a conversation. And what's really neat about Get Well is we're already in the hospital, that we're in the television in the hospital bed. And so it means that we can have a little pop-up that says so-and-so would like to join the conversation, and it doesn't have to be this awkward voice of God, kind of through some overhead. It really is seamless. It's a really nice. And so when we work with our healthcare partners on virtual technology, we look for as many use cases as possible for people to get, to be able to, take an at-home family member or a family member who might be out of state, who really wants to be, should be part of a conversation, to be able to bring that person in, or whomever else. So much we can do, and it's, I think, still new, but when an organization has a virtual, any kind of virtual technology, we have the ability to integrate in with that and make it seamless within, wherever they are. I also want to go back to Simi's question, which is like, what's the future-proofing technology? Because this is the other thing that gets me really excited. And what I keep saying to myself is, I travel a lot, and I'm always with one airline. It's American Airlines, because they're the DC hub here. And I always say, I feel like my American Airlines app knows me better than my health system does. Like, it tells me, it reminds me when I need to check in for a flight. It knows where I am. If I'm in the hospital, if I'm in the airport, it tells me when my flight is boarding. It'll even tell me like the path for how many minutes it'll take to get there. When I'm on a plane, it knows I'm on a plane, and it knows I need maybe a wire, I need Wi-Fi or entertainment. But it's like, it really knows exactly what I need no matter where I am, and it's just one thing. And I think Get Well, when I think about healthcare technology, but the opportunity to be able to connect with patients no matter where they are, and instead of discharging patients, I mean, if you look up the word discharge in Webster's dictionary, it means, the definition is to unload or to absolve oneself of any further responsibility, which is the exact opposite of what we're trying to do. So can we build a system that never discharges the patient, but instead connects with patients no matter where they are, knows where they are, and knows what they might need where they are, and so that they feel known, but also providing them with reminders, nudges, information, education, ways to make appointments, wayfinding, all of those things. And I think that's the direction, that's the aspiration for Get Well, is to help us build a system that never just charges the patient and instead connects with them no matter where they are with the health system.
All right, we're almost out of time. We're going to go with a lightning round of final piece of advice, and I'll frame it up this way. Pretend you're speaking to someone in your position at another health system who's just looking for maybe something that you feel has worked for you in your current role over the past few years. Kat, we're going to start with you.
What's worked for me in the past few years?
Yeah, what do you think? What do you think is something, an approach you've had, or a way you go about your work that you think has been effective?
Well, it depends. It's on different levels. But I think that planning projects in advance and getting collaboration and consensus with people and working through budget issues and getting projects on timelines for other people, because we don't work in a silo, right? That's super important. And then just being a voice, like in the vendor community, uh, what's really needed, organizing. I've organized vendors to come on site and spend several days following the nurses around so they can see
Mm,
where their challenges are. Lots of different ways of doing that. So the other piece is that we really haven't mentioned much at all, and I think that I've found that this is super helpful, is making sure that we have, and I think in the beginning, Simi might have mentioned it, um, like super user groups and things like that. There's always drift that happens once people are educated. Adult learners forget half of what they learn when they walk out of the room. And then we need to have people who are always constantly infused with, new features and functionalities and how things work. Sometimes some of the things are there and people aren't using them because they just don't know they work. Um, so I think that's super important, and it's something that I had established in my tenure when I was in New York, and in the process of doing that here.
that's great stuff, Kat. Thank you very much. Simi, your best piece of advice.
I think never lose sight of why we do our work. I think we're here to deliver healthcare. And so for me, when I think about what I'm doing, I always try to ask myself, is it improving the patient care outcome? Is it improving the nursing workforce? Are nurses able to thrive in this environment? Are our patients able to receive the right care at the right time from the right person anywhere they need it? I think as someone who I always say I'm a techie, and I love and if you went to my house, you would see the original iPad and the original Surface Pro and the original Apple Watch and the original this and that's not how you should adopt technology in the workplace. That might be what Simi does at home because she likes new shiny objects. But in the workplace, we really have to think about adopting technology that actually serves the purpose, and creates a sustainable healthcare environment that allows us to achieve our strategy and our goals and what we intended to do, not because it's got a fun feature, or it looks really good. So I think that that's the key is we work with our industry partners and others is to know that we're getting the return on the investment, that we're able to actualize it, we understand it, we're involved and engaged in helping to develop it. And that what we develop, we know isn't in an infinite process. It's not just iterative, it's infinite. It's always happening and having that mindset. So
Awesome, Catherine. We'll give you the last word.
Yeah, one of the ways that we can reduce some of the workload for nurses is to empower patients with the tools to have more control over their care. And that's really how Get Well was started. Get Well was started by a patient who wanted more knowledge and tools to have more control over his care. And so it's things like, we've been talking a lot about AI, but there's a lot of non-AI technology available today to reduce burden, virtual observation support. Can we enable patients to order their own meals? Can we enable them to make requests that bypass the nurse and go directly to the department that is most equipped to support them, such as chaplain or environmental services and that type of thing? And that's something that we've been doing for a long time, and we know it works, and it works really well.
That's wonderful. Absolutely great. We're about out of time for today regarding continuing education. You could use the final slide in this deck. You'll get an email when the on-demand recording is ready for viewing. If you want to work with us, you can reach out to Nancy Wilcox from our team and go to our website to register for upcoming panels. With that, I want to thank this amazing panel, Kat Collard, Simi King, Catherine Verkstis, and Get Well for sponsoring and making this possible, and you for attending. And with that, everybody have an absolutely wonderful day. Thank you.
Anthony,
Thank you, Anthony. Thanks, Simi. Thanks, Kat.
thanks.